Welcome to the Bernade channel. Thank you for joining us. Today, we'll be discussing a comprehensive nursing care plan for patients at risk of suicide, focusing on assessment, prevention, and management strategies for nursing professionals. Nursing diagnosis, risk for suicide. Risk for suicide related to feelings of hopelessness, worthlessness, or despair, social isolation or lack of support systems, history of depression, anxiety, or other mental health disorders, previous suicide attempts or self-harm behaviors, recent significant life changes or losses, chronic pain or debilitating physical conditions, substance abuse, family history of suicide as evidenced by verbalization of suicidal thoughts or intentions, expressing a plan for suicide. Gathering means for suicide, example stockpiling medications, sudden calmness after a nursing diagnosis, risk for suicide. Period of agitation, giving away prized possessions, social withdrawal or isolation. Nursing outcomes. 1. The patient will remain safe and free from self-harm throughout the nursing care period. 2. The patient will verbalize suicidal thoughts to nursing staff or mental health professionals as they occur. 3. The patient will demonstrate use of at least 3 effective coping strategies when experiencing emotional distress by discharge. 4. The patient will identify and utilize support systems, family, friends, or crisis hotlines, when feeling overwhelmed. 5. The patient will show improved scores on depression and suicide risk assessment tools by the end of nursing outcomes. The care period. 6. The patient will actively participate in the development and implementation of a safety plan before discharge. Nursing interventions and rationales. 1. Conduct comprehensive suicide risk assessments. A. Use validated tools, example Columbia Suicide Severity Rating Scale. B. Assess for risk factors, protective factors, and warning signs. C. Evaluate the patient's current mental state and emotional distress. D. Reassess regularly and after any significant events or changes. Rationale. Thorough and ongoing assessment helps identify changes in risk level and guides nursing interventions. 2. Implement appropriate safety measures. A. Conduct environmental safety checks to remove potential hazards. B. Maintain nursing interventions and rationales. Close observation as per facility protocol and risk level. C. Secure or remove items that could be used for self-harm. D. Ensure proper medication administration and storage. Rationale. These measures create a safe environment and reduce access to means of self-harm. 3. Establish therapeutic rapport and communication. A. Use active listening and empathetic responses. B. Encourage expression of feelings and thoughts without judgment. C. Validate the patient's emotions while reinforcing hope. D. Utilize therapeutic communication techniques. Rationale. A. Nursing interventions and rationales. Strong therapeutic relationship promotes trust and facilitates open communication about suicidal thoughts. 4. Collaborate in developing a safety plan with the patient. A. Identify warning signs and triggers. B. List coping strategies and distractions. C. Include contact information for support systems and crisis resources. D. Outline steps to create a safe environment, example removing access to lethal means. Rationale. A personalized safety plan empowers the patient and provides clear steps for managing crises. 5. Provide psychoeducation and skills. Nursing interventions and rationales. Training. A. Teach stress management and relaxation techniques. B. Instruct on problem-solving skills and cognitive restructuring. C. Educate about mental health conditions and treatment options. D. Discuss the importance of medication adherence, if applicable. Rationale: education and skills training enhance the patient's ability to cope with stressors and manage symptoms. 6. Facilitate involvement of support systems. A. Educate family members about suicide risk and warning signs. B. Involve family in treatment planning and safety. Nursing interventions and rationales. Measures. C. Provide resources for family support and education. D. Assist in reconnecting with supportive friends or community groups. Rationale: strong support systems can provide emotional support and assist in monitoring the patient's safety. 7. Coordinate multidisciplinary care. A. Collaborate with psychiatrists, psychologists, and social workers. B. Ensure continuity of care through proper documentation and handoffs. C. Facilitate referrals to appropriate outpatient services. D. Assist in arranging follow-up. Nursing interventions and rationales. Appointments before discharge. Rationale: a multidisciplinary approach ensures comprehensive care and smooth transitions between levels of care. Nursing evaluation. 1. Monitor and document the patient's safety status throughout the care period, including any self-harm incidents or suicide attempts. 2. Assess the patient's ability to verbalize suicidal thoughts and use coping strategies through observation and patient interviews. 3. Evaluate the patient's engagement with support systems and use of crisis resources when needed. 4. Compare pre- and post-intervention scores on depression and suicide risk assessment tools. 5. Review the effectiveness of the safety plan and the patient's ability to utilize it appropriately. Nursing evaluation. 6. Assess the patient's adherence to treatment plans, including medication compliance if applicable. 7. Evaluate the patient's readiness for discharge or transition to a lower level of care based on risk assessment and treatment progress. Important notice: this presentation is for nursing educational purposes only. Always follow your healthcare facility's policies and procedures for managing patients at risk of suicide. Immediate action and consultation with mental health professionals are crucial in high-risk situations. For more comprehensive information on mental health nursing and suicide prevention, download the BurnAid app for free from the Play Store or App Store, featuring answers to over 3,000 nursing-related questions.